Hey, Mark, are you scheduled to work to launch next week?
Yeah, I'm working swings up to launch. How about yourself?
Yeah, they've got me on the re-entry team.
Who's a knucklehead left the box to be moved?
I don't know.
Let's move this before it falls on something.
Yeah, I think that's a great idea. Sure thing.
Ready?
Ready? Go.
Whoa, grab it! Grab it! Grab it! Grab it! Grab it!
Mark, you okay? You okay, partner?
Oh, this is gonna leave a mark. I bet you ruined my new shirt.
Control, 461. I need help. My partner, they had a beam fall on him in the south end of the transfer aisle of the VAB. Send help quick. It'll be okay. I got help coming, Mark. It'll be fine. Just hold on. Just hold on, Mark. It'll be fine.
You said help me lift it, not throw it on me. Oh, thanks a lot, buddy.
I'm sorry. I'm sorry.
Involving a patient with blunt thoracic trauma presents the pre-hospital provider with a patient that could have a number of very significant and potentially life-threatening injuries. In addition to the danger presented from the intrathoracic injury, abdominal injuries could also be present, increasing our patient's risk of having a bad outcome. It is always critical in a situation like this one, and particularly with any trauma or industrial scene, to ensure scene safety for both you and your crew.
Hey, what happened? My partner and I, we tried to move this beam. It fell on him. It went across his chest.
In the scenario you have just witnessed, the crew arrives on scene and is presented with a 42-year-old man who had a metal beam fall on his chest when he and a colleague were attempting to move it.
Sir, can you tell me what happened?
Yes, Mark and I were...
His co-worker witnesses the accident and calls 911. Our patient is in obvious respiratory distress, complaining of difficulty breathing and right-sided chest pain. What is your immediate treatment? Your immediate treatment when you arrive on the scene is to make sure the scene is safe and to perform the ABCs while maintaining cervical spine immobilization.
Dan, I need you to get him on 100% oxygen with a non-rebreather mask.
Notice how scene safety is a top priority for the crew in this scenario. This crew is accustomed to working in an industrial area and has strict protocols and procedures about scene safety. They are also correctly performing cervical spine immobilization while simultaneously obtaining a history, vital signs, and thorough physical exam. ABCs. Our patient's airway is clear. In blunt chest trauma, the patient's airway should be carefully assessed by listening for airway movement, inspecting the nose, mouth, neck, and lung fields, and looking for chest retractions and abdominal retractions. Our patient is having obvious difficulty breathing, a rapid respiratory rate, and has diminished breath sounds on the right chest with pain on palpation of the right chest wall. On initial exam, there is no neck vein distension. In cases involving blunt trauma, breathing should be evaluated by exposing the chest and neck and visualizing the neck veins, in addition to observing and listening to breath sounds.
Okay, you're gonna be okay. Take a couple of deep breaths for me.
Some signs of a significant chest injury may include distended neck veins, increased respiratory rate, and hypoxia. Do not let these important signs go unnoticed.
Okay, I've got a lot of bruising to the chest. Sir, do you...
Pulses are present, but the patient is tachycardic. Pearl of wisdom. Checking the ABCs and rechecking the ABCs frequently in the chest trauma patient are of critical importance. These patients can decompensate quickly. Your hypervigilance and attention to detail in the chest trauma patient will prevent subtle deterioration in a patient's condition from going unnoticed.
Sir, do you have any medical problems I need to know about?
No.
Do you take any medications?
No.
Are you allergic to any medication?
No, nothing I know of.
Past medical history? None. Medications? None. Allergies? None. Social history. Our patient does not smoke, drink, or use illicit drugs. His last meal was 1 hour ago. Vital signs. Temperature, 98.6. Blood pressure, 180/80. Respiratory rate, 28. Pulse, 138 and regular. O2 sat, 86% on room air, 100% on oxygen. Physical exam. Our patient is anxious and appears uncomfortable with obvious difficulty breathing. His HENT exam now shows that JVD is present, but there is no neck pain with palpation. Lungs. He now has absent breath sounds over his right chest.
Okay, we have no lung sounds on the right. I believe we've got a tension edema. Dan, can you set me up with a 14-gauge needle for a decompression?
Chest exam. There is a large abrasion over the entire chest wall. There is pain with palpation of the right chest wall and right clavicle. There is no flail chest, no subcutaneous emphysema. Cardiac exam, regular rate, but tachycardia is present. There are no murmurs. Our lead medic appropriately pauses with his physical exam to perform a life-saving needle decompression of the right chest.
I gotta put a needle in your chest to help you breathe a little bit better, okay?
Abdomen, soft and non-tender, with no rebound or guarding.
Okay, Mark, I'm gonna push on you. Let me know if anything hurts, okay?
All right. The chest hurts.
A little bit on the right there.
There is a large right chest wall contusion extending to the right upper quadrant of the abdomen. Back exam, very important. There is no pain on palpation and no skin lesions. Extremities, there is no pain on palpation and no pedal edema. There is a large contusion over the upper right arm. Skin is cool and dry. Neuro, alert and oriented ×3. Non-focal, speech is clear. Glasgow Coma Scale, 15. The patient's physical exam has provided us with a number of very important clues about what type of injury was sustained after being hit with the metal beam. It is your job to be a detective and piece together this information to accurately treat our patient. Our patient has shortness of breath, diminished lung sounds on the right chest, tachycardia, and he has now developed distended neck veins. There is also pain with palpation of the right chest wall and right clavicle. These are all very important clues.